Now you look at talent and workforce, particularly in life science, it's multifaceted problem. It comes down to policies, it also comes down to skilled, what do we call skilled workers, then it also comes down to upskilling, and then there's a real question of where do we automate. Automations, for example, pipetting, it's a robotic solution. So there's that balancing with life sciences does require higher degrees, PhDs, and so think about from a policy perspective, from even if you look at the United States, turns out 80% or so PhDs in engineering science are immigrants. And so what are some of the policies that help you retain that here? The other part is that if you have a skilled sort of workforce, there's a real question of burnouts. And so I was looking at, I think, McKinsey report. It says that life sciences ranked third or fourth in providing some of these mental health supports and things like that. So that's part of the talent sort of retainment and things like that. And then the automation is a real thing, right? I mean, if you're going to have workers who are going to displaced with automation, which from productivity standpoint will make a lot of sense, but are there programs to upskill them? The last thing I'll say on this is the education part you mentioned. A report suggested last year that if you look at the distribution of degree requirements in life science, actually reduced to even a community college. And so idea is that I think instead of having a proper 4-year degree plans, do we have vocational programs that sort of folks either can upskill or can get into that and sort of find workplace and workforce in life sciences. What about sort of once the technology's been deployed in terms of change management, resistance and all? Before being an investor and an academic scientist, I had a parallel career as a Salesforce architect. And I did work with life sciences companies in digital transformation and at, sort of going from on-prem onto cloud and things. And, QMS systems and change management and Kappa and sort of looking at deviations. These are very important sort of solutions that require either paper trail or spreadsheets. And you look at what cloud sort of brought to table was sort of the 360 view of a product that a life science has, from the moment is being researched, R&D, if there were, what happened, who approved it, from it goes to manufacturing process, any deviations, any events on the factory floor. Once it goes to a consumer or a patient, all the sort of what we call adverse effects, all of these are siloed processes, and there's inherent risks involved, the compliance. If you're ISO certified, you have to keep track of all your deviations in the processes. I think that's what cloud brought to the table. So initially, I think it's that, we mentioned that roadmap. Forget AI, do you have a roadmap for digital transformation? It becomes very important because it can streamline it, or it can have the opposite effect of just burnout, and now we have other tool to use. I mean, you can see that in healthcare a lot. If you ask any nurse what their thoughts on an EHR system, or doctors, they feel, the number one reason they feel burnt out is they see the patients, they love what they do, they want to give the diagnosis, now they have to go back and put their notes in. And that's a real burnout. And so, and you must have seen in recent news that you have companies like ambient, they're looking to transcribe the ambient sound that listens with the doctor, and it automatically takes the notes, and out comes these medical codes, and it's really addressing the burnout issue. So I think that that's the landscape that I see, where there are opportunities, challenges, and for us to kind of start thinking through on what that means as a community. I think it's just a community thing.